My name is Mike Bedell, and I'm with Tampa General Hospital. I manage the BI analytics team here, and we also have
Fausto Gonzalez.
And Fausto is our one of our senior BI architects here at the team, and today we wanted to share with you our experience and what we've actually worked through during this pandemic with our analytics and just how we've orchestrated some of the response and recovery efforts around it. So within the BI analytics team here, we've actually been working through a lot of our initiatives around just insights to Tampa General, our community, the state of Florida, around this pandemic. And we've had several initiatives with delivering dashboards that are actually providing the insights needed to make the correct decisions as far as whether we have enough bed capacity, we're running low on PPE supplies, or even some of the Fed and state reporting requirements as well. So as you can see here, we've engaged with several of our state national reporting as well, and developed quite a few dashboards that provide those insights. And today we want to take the time to basically just share with you what our journey has been like during this pandemic and how we were able to orchestrate all that. So initially with the pandemic, we had some questions that we had to answer from our side, things that were helping our senior leadership make the right decisions when it came to making sure that we had either the correct supplies, the correct turnaround time within our labs. And those results really helped drive our initiatives here within Tampa General, but also helped understand where our patients were coming from. And during that time, we were able to develop this dashboard, which we call our TGH COVID-19 tracking dashboard. And this really is where we were showing folks inside of within TGH first to start with was how many lab orders are we processing a day? What's the percentage of positive rate for our patients that are coming through Tampa General and being identified as COVID-19 positive? It also helped bring insight as to where our patients were coming from, what zip code within the region that we support, where is the hotspots around the COVID-19 initiatives. And it really proved itself very valuable within not just our team, but when we started engaging with our community as well, helping them become more aware of what our community was looking like and everyone that Tampa General supported around us. So within that, we had to answer quite a few questions on our side, and the questions that we were answering throughout with these dashboards really came from various systems on our end. They were from starting point from our Epic EMR system, our main medical record system. We've also broke ground by starting off with some new APIs. This was something that the BI and analytics team really never dove into until this pandemic. And it proved its value in gold. We were able to tell real time what is our patient capacity looking like, how many orders are we seeing throughout the day. We also have other sourcing systems that we tied to, and we brought this all together with these dashboards that we were providing the insights with. So there were sources like SQL Server, other databases that we tied to. In some cases, we couldn't access these disparate systems, so we were leveraging Excel files and also tapping into data that was coming directly from our labs and that weren't necessarily processed through Tampa General, but from other labs like LabCorp, for example. So it really lends itself to allow us to tie it all together, bring all those lab test orders, and also identifying whether these are in-house or reference labs that we needed to basically tie to. So One of the other initiatives that came through this pandemic was a collaboration that we had. In this case, we went ahead and collaborated with uh, what at one point would be some of our competitors within our region. We actually collaborated with 6 different hospital systems, and basically that covered 13 counties and a total of 50 plus hospitals around us in our region. The initiatives here were really to look into our bed capacity, our ICU capacity, and our ventilation utilization, and that to us was huge because in a time like this when we really are we could be competitors during the pandemic, we kind of put ourselves together and said, let's make sure that none of our hospitals within our region are going to be overwhelmed at any point in time. So the biggest requirement out of this was, how are we going to collect all this data? Collecting the data from disparate systems with different security requirements, with different methods of delivering the data was a little bit challenging, but we broke some more ground there as well. And we'll go into some of the initiatives there when we get into more of the technical piece with AWS3 and how we collaborated around that. But it really lent us to provide more insights using our dashboards. And this is the Florida West Coast Regional Data Exchange Dashboard, how we called it. And that's really what helped not just Tampa General Hospital, but all these other 50 different facilities around us to understand, is there a concern in one hospital versus another? Are we going to have to shift patients from an ICU down south of us over to Tampa General because maybe they're getting overwhelmed? But it was really instrumental in making sure that we were providing the insights for our region, and it also honestly helped our leadership within the community. So these were dashboards that were shared with our mayor at Hillsborough County, and they were looking at this daily and still are to this day. And we also shared it with folks like the Secretary of State, the governor, just to give them a little bit more of an insight of what our region looked like here within the West Coast region of the state of Florida. Another initiative that we had during this pandemic that was really leveraged and was insights into our PPE, our supplies. Are we running out of these supplies that are driving the pandemic and the needs for these supplies? So things like your masks, your gowns, testing supplies. Do we have enough? How many days on hand do we have of each of these supplies? Do we have any concerns? This was really instrumental. Before this pandemic, we did not have the ability to get all this information together. But again, within Tampa General, we collaborated, we looked into it, and then we also even took it to the next step of creating what if scenarios as well. So during the response piece of it, it was really more of gathering the information and putting it all together from these disparate systems and departments, and also then and then surfacing that. But then we also took it to the next step of, as we start getting into more of a recovery state and more operational, some of these PPE supplies were also being used just for daily usage or operational purposes. So if we start bringing back in some of our surgeries, for example, and some of these supplies are being used there, how much of an impact is that going to take for our COVID patients? Are we going to have enough? Should we be considering ordering more? So again, these were some of the insights and questions that were answered with these analytics that really proved itself valuable during this point in time. Another one that we had here was, and this was a more recent one, is Hillsborough County and as well as TGH as a whole. We actually partnered together with IBM to bring in some of their forecasting models to really help us out with ICU bed capacity and hospitalization. What are we looking like for our county? Do we have any concerns with any of the assumptions that are being made or scenarios that would be coming up? Things like as soon as schools start opening up, do we have any concerns with seeing a higher peak there? Then that would potentially trigger us to maybe bring in some more PPE supplies to accommodate that. So this was really huge for Tampa General, and making sure that we had the ICU capacity, hospitalization forecasting models built in. Internally, we also built our own inpatient med surge and ICU forecasting models as well. One of our resident data scientists here also helped us with making sure that we had insights to that. Some of the predictive models that we built have proven itself to be following the same trends. So that has been key for us. And these are just some of the insights that we've been able to basically get us to the next step within this pandemic. So with all that being said, I want to just to point out, this is where we want to tie it all together. What helped us get to this journey, and that's really Control-M. So Control-M helped us orchestrate a lot of these initiatives, and we actually touched into some new ground that really we didn't know that was even capable or possible with Control-M until we started digging. How are we going to compile all this data from different hospitals, for example? We'll get into a little bit more on the technical piece, but some of the key technical requirements for all these initiatives are laid out here, where you can see, data ingestion, the transformation across multiple TGH data sources. That was huge, and Control-M played a really large part on that. Just integrating with all these different systems, making sure that the correct predecessors and successor jobs, whether it's to integrate data together from a SQL server over to our Qlik dashboard, making sure that reloads are taking place and they're running in the correct order. That workflow and execution that was being done there, that was tremendously driven by Control-M. Also, just as you can see here, notifications and alerts, those were huge for us. A lot of this with how pertinent this information was, we knew that we needed to make sure that we were getting the correct notification alerts when something did not go right. We didn't have a lot of room for failure, knowing that now we have a lot of leaders in the organization, within the organization and outside of the organization, that were becoming more and more dependent on this data and these insights. So that was huge for us. Notifications to the business users when things weren't running timely. That was another huge requirement that we had, and we were able to accomplish this through Control-M. So I'm going to go ahead and turn this over to Fausto, and he'll go ahead and touch base a little bit more on the technical side and what we actually did to accomplish all these, bringing these insights together and helping orchestrate all this.
Thanks, Mike. So how do we get all this data from these different systems and different processes and from different institutions out there that are trying to leverage this data to make decisions? We use Control-M to pretty much marry a lot of these disparate type of either technologies or processes together, and starting with our database jobs in Control-M. So earlier you saw a slide where our EMR is Epic. It's a cache database. That's what we call our real-time or operational database, and that's where we're getting the real-time API is created there and flowing that data in through SSIS to create kind of a real-time system, a mini batch system of ETL processing as well. Also, Epic has a relational database called Clarity, where we also surface some patient information through there, and that has a latency of a day. So how do we marry up, real-time operational with, kind of 1-day latency data, also tapping into our laboratory system, which is SunQuest, and we're tapping into that real time, right? So with Control M, we were able to kind of synchronize all those different jobs and processes together in order to really surface that data as accurately as possible throughout our dashboards. And the Control M database jobs were perfect candidates since we have SSIS. We're primarily a Microsoft Windows SQL Server shop. So this was beautiful. Over here, you see an example where we're basically just running through the same kind of data warehouse lifecycle, where we're getting the data from our sources, we're staging it, we're inserting, we're doing the updates right into our target data stores. Also, one of the big challenges is now that we're working with other hospital systems in the area was how do we get that data back into TGH? With the pandemic, a lot of folks now were working from home. So one of the biggest challenges was for them to deliver the data to us. We have a system to receive files, but in order to do that, we have to have a static IP address to whitelist, right? So that's one of the security requirements. Not many folks have that when they're working from home. One of the options we looked at was also email. But how do we automate, email coming from all these different systems and processing it? Email automation has its nuances. So we looked at Control M and try to figure out what's the best route possible. And we saw that basically right out of the box, Control M has AWS S3 for managed file transfer. So it was pretty easy to set up an account, an S3 bucket up in the cloud, and get that set up, create our secret access key, and just hit that button right there for our managed file transfer for S3 and get that rolling. You'll see also there in Control M in self-service, we have a screenshot of basically the files coming in from different hospitals. It was very user-friendly from an AWS standpoint. Everybody recognizes Amazon up in the cloud, and very easy for them to basically just drop files in there. And we just set up a Control M job to go out there and grab those files, process them through, and put them through our database and onto basically a data pipeline to our dashboards. Now, our dashboards, right, has its own scheduling system to reload data. And one of the key initiatives that we wanted to do with Control M when we brought it into TGH was basically use Control M to schedule all our jobs regardless of the technology that we have. So the OS job is a beautiful component where we're leveraging PowerShell commands. So our analytic platform is Qlik, and Qlik does have basically an API or command line module that's available from GitHub. We downloaded that when we installed it onto the Control M servers, and we basically set up our OS jobs basically to run PowerShell scripts to connect back up to our host, which is in AWS, and do the reloads, schedule all those jobs through there. And basically, we're now managing about 91 reload jobs from Qlik, and also we have another solution there that sends emails out of basically a picture of dashboards, which is called through end printing, and we're doing that through Control M OS jobs as well. As you can see, there's a PowerShell command. That's basically what it looks like. Pretty simple. Get the right service account, set up, and you're off and running. So that was a huge win for us to pretty much automate all that scheduling done in Control M. The other things that we liked about OS jobs, since it's versatile, is basically, and with most jobs in Control M, are the on-do actions. So we're using PowerShell to kick off these jobs, and we get the output right through Control M. And basically, native Qlik doesn't have any alerting. If a job fails, we have to go to their management console and look at it, physically go in there, log in, and see what succeeded, what failed. Through Control M and using PowerShell and the OS job, we're getting that output automatically. So we can search basically for the status of the job, whether it failed or succeeded. And if we did find a failure, right, we were able to create a email notification that was sent basically to our team and also to our on-call team as well, so we can react to those failures quickly. And that was a really nice thing to have, because that's something that we didn't have before, but we were able to accomplish that through Control M. And that takes us to our next slide. We're pushing our alerts, and we're pretty much moving a lot of our scheduling, pretty much all of our scheduling, through Control M. So we're centralizing all of our monitoring, all of our alerting from these different systems and technologies through Control M, pushing those alerts to our on-call phone, and also setting up complex alerts. I think something that Mike talked about, that was a huge win, based on certain events and certain bin jobs that we have in Control M. So if we have something that's being delayed, right, we have basically some undo actions. Here's an example here where if we have a notification that basically we have a number of failures hit 40, we order another job to basically send out a canned email to leadership or specific teams and automate that, and note that this is going on in the early mornings where we people that are on call don't have to get up and do it, right? So we're trying to automate as much as possible and take advantage of Control M. So that was huge. The other thing through our journey here with COVID and using Control M really to help us out is we were running into a concurrency problem with Qlik, as we pushed more jobs and more dashboards were created. Right, we're not just creating dashboards for COVID response and recovery. We're also creating dashboards for other departments and units. And our, everything's growing. Everybody wants, analytics. So this created a big concurrency problem, because out of the box, Qlik has, the way our architecture was, it's a default max concurrency of 4 tasks, and also a default queue timeout of 30 minutes. Our COVID dashboards are pretty much have a cadence of either 15 minutes reload, 30 minutes, or depending on certain COVID dashboards, some hourly. So those are some of the tasks that we had to basically figure out. How do we, figure out what is the sweet spot, what is fine tuning our architecture to safely set our max concurrent reloads to a higher number and our queue to a higher number. And we were able to use basically Control M to really look at it visually through their Gantt chart, and also using their statistics of past jobs run. And we were basically able to identify some performance issues that we might have had on the dashboards, clean those up. And over here on the left-hand side, you'll see one of the jobs runs at 4, 5, 6, 7 a.m. hourly. You'll see at 4 a.m., that runs about in a few minutes. But when it gets to 5 a.m., 6 a.m., 7 a.m., those durations are longer, because now we are competing with concurrency issue. So those durations are really an additive effect of the scheduled job being in queue, and also its execution time. And you'll see sometimes it'll bleed over to the other hourly spot, right, when it's supposed to kick off. So with Control M, we were basically able to identify all of that, and really on the right-hand side, kind of mitigate those concurrency issues. So that was another huge win.
And I'm going to jump in here real quick, just because I'm very proud of the team and what we've been able to accomplish here during this pandemic, and really providing those insights. It's very humbling, and from a technology perspective, how we have been able to really impact patients' lives with some of our insights. So when we feel pretty proud when we hear comments like this, some of our vice presidents, these are comments that have come back from them. We're breaking silos when we're competing, right, against hospitals. But during a pandemic, we're collaborating, and very proud of Tampa General Hospital and what we were able to accomplish during this time. and come together and bring all this data together so that we can help our community, our patients. I mean, even to our CEO, Mr. John Corris, he's recognized the value of powerful tool and collaboration during this time, right? This is really amazing that we were able to do this with technology and orchestrate all this data from disparate systems, sources, and in this case, even facilities that would typically be competitors. So I just wanted to also touch base. This is another quick slide for us on our architecture, and I'll let Fausto kind of talk a little bit more of what we look like BMC control M.
Yeah, so this is our basic architecture of our production environment. We have basically two nodes, primary, secondary nodes on a co-location as well. Control M is basically on a VM, Windows Server 2016. We're using Active Directory for our authentication and security, and also using Postgres out of the box with replication. So we have high availability for those failovers. So we started out our journey in Control M with version 9.0.18. And then a few months later, version 19 came out. And with this architecture, we were basically able to do in-place upgrades to 19 by basically failing over to one node, doing an upgrade, and then finishing that up, failing over to the other one, and doing that in-place upgrade with minimal downtime. So we just wanted to share that if people were interested or wondering how we have things set up.
Great. And we just wanted to also end it here from our journey with Control M, and how not only how it's helped us here within our BI analytics team, and hopefully at one point the organization with everything else that could potentially be scheduled. But so far, this is where we started. As Fausto noted, we started with version 18. A few months later, we went live, recognized there's an update there. As we started getting more familiar with the tool, took care of the update. One of the biggest milestones that we had was really at the end of last year, December, was we have a daily blast metric report that goes out to all senior leadership here. This is part of being an open door and providing the correct insights to our leadership here to drive the organization. Well, there was a requirement to have this report out by 8:30 a.m. each day, and we're really running against a lot of barriers there with other ETL jobs outside of our realm that we really couldn't control from our EMR in this case. With Control M, we were actually able to bring that SLA to a delivery of average coming out at 3:30 a.m. We also then incorporated some of those alerts to let us know if there are anything going on, and also the advanced alerts that Fausto discussed. So to us, that was a really huge win and success, but we didn't stop there. We kept building and adding to it. Shortly after that, the beginning of the year before the pandemic hit, we had about roughly 50 jobs. During the pandemic, we found ourselves looking for ways to integrate and create the right processes and workflows for our new initiatives that we had during the pandemic. So during that time, that March through, I would say current, we're still there. It's not behind us yet, but we've been working through and adding more and more to BMC Control M. So as of June of this year, we've created a lot of our ETL jobs to be called and scheduled through Control M, reports that are being executed using SSRS through Control M, our Qlik Sense, which is our primary analytics dashboarding tool. We are really running all of our reloads through there now, and started leveraging some of the SFTP functionality as well that we have to send out data to some of our vendors and partners that we engage with, or even some of our reporting requirements that we have here as a hospital. So at this point in time, as of August, we really shifted into that Qlik sense mentality, added about roughly 91 jobs from the reload perspective there with Qlik sense. And where you see us right now, we're as of September, we're at 250 plus jobs. So our journey with Control M has really expanded. We don't see it stopping, and we're hoping that as an organization we leverage it even more, not just for the BI and analytics team, but for other teams within the organization. With that being said, this concludes our presentation.
Thank you.
Thank you.